center or
Yeah,
whatever.
exactly.
And we already talked to parents about this beforehand. That he's gonna cry, he's gonna scream. Are you okay with using the board? If you are, then
And you let the parents sit there? Like
Yes.
children? Yeah, always. Huh?
The assistants are really good, but to be honest, it makes a big difference when the doctor is also good at talking to the patients.
Talking to the patient.
It really matters to the parent, and they do see you like how you are.
Do you have training videos or like some paperwork to tell her what to say?
You can train on the job.
It would be
little
watching,
bit,
observing
yeah.
more. Yeah.
Because I don't have any videos, because it's like different. It's so like different
per
with every
patient.
patient.
Yeah.
So the best thing to do is kind of watch us and then kind of learn your own style. Because you cannot copy someone 100%, but at least you can learn a little bit from him, me, or the other associate.
have an
and,
idea.
Yeah, and then make your own style. You know, and then like pick up all the good things from different people.
What software do you use?
We have Dentrix Ascend.
We just moved to Ascend.
What did you guys have in?
Dolphin.
Oh, never heard of
Yeah,
it.
different.
We have
Ascend is cloud-based, so it's
Cloud-based.
a website. Yeah.
You don't have a server?
We
No.
did.
We just switched to Ascend last month. So
To
for
a
the
server
new
or to
office,
a cloud?
To cloud, yeah.
Yeah.
So next office we won't have a server. Yeah.
You will or won't?
Won't.
Yeah. Cloud is the new thing now.
Cloud, yeah.
That's
yeah.
why we just changed. So we used to have a server, and just like 2 months ago, no, last month.
And we
changed.
still have a server room in the new office and things like that for security. We have cameras everywhere, encryption, all this stuff, like high quality security if we can. So for that, we do need like a small server. But the main dentistry is on cloud. Yeah, now. Yeah.
Is where's your office located?
So
on
our
Truxton.
first is on the Truxton, and the second one is.
Where she's gonna be? Which one's that one at?
We haven't decided. That
Yeah, we don't
depends
even
on
know
her.
where we're
like,
going.
Yeah. That
Truxton
depends
and
on
what?
your doctor, yeah.
Truxton and
Calipari.
no, Truxton. It's by CBCC. Do you know where that is? Comprehensive Blood Cancer Center.
Mm-mm.
Yeah.
You know Fugadi's?
Fugati's? That restaurant?
That is-
Yeah.
Yeah, in downtown?
No. It's on Truxton.
That's in Visalia. There's a Fugazi's.
Yeah, you know. Yeah,
Oh,
you know.
yeah.
You know Visalia well, yeah.
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 Come there
But
often.
yeah, it's
yeah.
on Truxton. If you type in My Kids Happy Teeth, you'll see it.
Okay.
Yeah, on Google.
Your company name is My Kids Happy Teeth.
My Kids Happy Teeth. Yeah.
And when is the clinic opening?
Oh, it's saying August right now.
Okay.
So if everything's on time, construction, then August. But yeah, August, September, hopefully.
Okay.
Yeah. Hopefully everything goes in time.
Construction is
Expensive,
going.
huh? Yeah.
Permit took a long time.
Yeah, that's where we.
You're building scratch building?
Yes.
It's not, we're leasing it.
Oh, leasing, but
We're
build.
leasing. But it's a new building, so we got to design it the way we want.
way you want
That's
it.
the advantage. Yeah, it's expensive because
Yeah.
I'm building it now,
Yeah.
the whole thing. But it's worth it. It's a good location.
And you
close to-
signed a long lease there, huh?
Yeah, 15.
That's not bad.
15 plus 3 5-year options.
But then, the owner has to pay for all the building inside, right? Or
No,
you're
not the
paying?
inside.
No, that's you built to suit you guys.
He's
then.
paying
The shell.
tenant improvements.
Right.
He's paying a
The
little
shell,
bit
yeah.
of it, but and it helps a lot. But most of it's me. Yeah.
Okay.
But it's a good buy. Yeah. Good investment.
In Bakersfield, yeah. If we compare it to Orange County or other areas,
Millions of dollars
not
over
even
there.
thinking. Yeah.
Millions. And Medi-Cal pays the same price Bakersfield and LA.
How's Selma?
Selma just Medi-Cal, same thing, a lot of Mexicans.
Okay.
A lot.
Is it as big as Bakersfield or smaller?
Fresno's big. Selma just touches Bakersfield. It's like,
Is it Clovis?
yeah, it all touches.
Yeah.
It all kisses up together. Fresno.
We like
Clovis.
that area. It's
Yeah,
nice.
Clovis is
Clovis really upcoming too.
Yeah,
Yeah, close is
Yeah.
His family members.
even Visalia, I like. Yeah.
yeah. I mean, it's just all Medi-Cal Mexicans, anyways. You know,
Yeah.
so yeah. Okay.
Yeah.
So when would you need her to start if you decided? August?
Yeah, I know.
August,
right now,
September?
Some doctors we interviewed in like March, and
They're like right now.
No, we haven't even talked to them yet again because it's like they know it's in August, so we're still. I think as time comes closer, and if we're finalizing August, then we should start doing work interviews around August time. Yeah.
Old office.
Okay.
Yeah, in our old office, as soon as we can split up, because right now it's so full, the associates are always there, so I can't even have one day of like interview with anybody because somebody's always there working. You know, the associates. So if the associates take a day off, or she goes on vacation for a week or so, I might text
just
you
call,
and say
text, and you
if you
come.
want to come one
One
day,
day.
2
Yeah,
days.
of course,
Watch.
if you're available.
Yeah, if you're available.
How many square foot is the new building?
5,000.
5,000.
Yeah. This one is 1,700 or so.
So the 5,000 square foot building, again, how many operatories?
11. We made it
11 treatment rooms.
5 treatment rooms, 6 exam rooms.
Okay.
Yeah. We made it spacious.
Yeah.
We didn't want to pack
Crush it.
as much as possible.
Yeah.
But
Because
with
this is our
pedo,
home.
it doesn't work like that. With pedo, you need room.
You need
Because
room.
a mom is not gonna come with one child. She's gonna come with a grandma,
Yeah,
2
we-
other kids.
So
need
you
room.
can make it work because I know pedo offices that Shira's designing. Oh my god, open bay, like 15 chairs just here
Yeah.
in one room.
Uh-huh.
So we don't do that because we're talking to some parent about your kid having cavity.
Yeah, and then one kid
don't
cries,
wanna-
they all start to cry. Yeah,
Yeah.
That's
it's like
what
a
we
joke.
had in our school, and it did not work.
Yeah.
out.
You don't
So how
wanna
many
talk-
chairs you put? Then you put a wall. How many?
One
Oh,
per room. Yeah.
one per room, huh?
Yeah, so the whole family sits in there if they want. That's why it's a more of a private consultation.
Yeah, it's not like this meet of the run like Children's Choice, just in and out.
It's not a clinic.
private. It's not a
it's
clinic.
a high quality.
We worked in
dental
office like
yeah.
that, and we wanted to change.
Yeah.
I get it.
Yeah, we worked in office.
So, even the hygiene is in separate rooms.
Yeah. So we have 11 rooms total. So like,
Mhm.
let's say in the afternoon 2 treatments don't show up, and there's a lot of exams waiting. We'll start doing exams in the treatment rooms. It's fine. It's just a closed off room because the patient might cry. You don't want the cries to go outside, so it's a quiet room.
And then when you go to the exam, anyways, you just run in and out, anyways.
Yeah, yeah.
I
it's
get
quick.
they're saying this. You
Yeah.
guys are smart. Yeah, you
Yeah.
really thought it out.
And the exam rooms are open. They're not like closed with doors.
Uh-huh.
They're just open.
Okay.
But there's wall there and it's closed off a little bit. You know, so
Like
it's
a
private.
cubicle.
Yeah, it's like privacy a little bit. So
Mhm.
if I'm talking to you and saying your kid needs to brush better and eat better, I don't want 3 other families to listen. You know.
Smart.
And we
It's
work-
not a clinic. I get
Yeah,
it.
yeah.
You really
But
thought this out.
We don't want to open a clinic. We're not doing it for the money.
It's like you're fighting all these other Medi-Cal clinics with their kids, but now they get personal service, so they're going to stick with you.
Exactly,
They're not
yeah.
going to go to Western or all
Yeah.
the other.
It's just one aspect as you're not chasing money.
Right.
Because we could easily make this 5,000 square foot into a big pedo bay and just do as many patients as we can, and it's like we're just making money. But
In the long run, it
patients
does
are not happy.
The
turn
pa-
out. Yeah.
The parents pay attention after a while.
patients, parents not
Because
happy.
Yes.
your
Those
reviews,
patients,
yeah.
like you see your reviews and everything in those offices, they tell you a lot about like in the long run, is it worth it or not?
Right.
Don't be like a one-shot star. Think about the marathon.
The marathon.
We've always
yeah.
been more about a little bit less stress is better than making more money.
Right.
We're like you in that way too. Like all our life is not just about dentistry.
Yeah,
we
you
want
need
to
to
have
stop.
a balance, have less stress. Like we're already stressed out. In
No kids yet.
schools
You don't
and
gotta have no
all
kids
that.
yet.
Not yet.
We're
but
gonna do
hopefully-
surrogacy.
Huh?
We're gonna do surrogacy.
Oh, really?
Okay, good.
Yeah.
Yeah,
Yeah,
congratulations.
Yeah, we're gonna do that. Yeah.
Yeah.
Yeah, hopefully everything goes well.
Yeah, better.
Yeah.
Yeah. No, that's
Yeah,
good.
there's a future.
Congratulations. Yeah,
Yeah, we're trying, we're
that's
ready,
another
but-
journey for
Yeah,
us.
you should do
to start.
surrogacy. Yeah, it's good. Yeah.
Yeah.
Um,
But for that, you still need to take hormones and things, no?
to extract the
Yeah.
little bit, yeah.
So did you find good doctors? or-
Yeah, there's a place in LA.
Very nice.
Oh, in LA. Okay, so you're traveling.
Yeah.
Yeah. Hopefully everything.
Yeah,
It's like
that's a
110,000. So
Oh.
How much?
110.
110,000?
Yeah.
Wow.
Very good candidate then, right? Hopefully, yeah. That's good. That's
Yeah.
good. The higher the price, the better the healthy the candidate. Yeah. But it's tough. It's tough. We'll see.
Yeah, when you're in the medical field and both people are medical field, it's tough to start the family. Yeah.
I know.
Yeah.
Oh, yeah.
School and this and that.
Yeah, we're
It's a
above
long,
35
like,
already.
We
so-
Yeah,
graduated
yeah.
from India in 2011.
Wow.
After that, it has been back-to-back school,
This,
school,
that,
school.
this, that, yeah.
So,
moving
yeah.
from countries and family and
by the
this,
way,
that.
I had a question. Do you speak Punjabi?
Yes.
Yeah. Okay. We have a lot of
We have a
Punjabi
lot of
patients.
Punjabi patients.
And
You heard there's so many Punjabis here
This,
too.
there's 4 gurdwaras right in this area here.
Oh,
Oh,
really?
really?
Yeah, and all this heavy Punjabi area, this
Yeah.
Panama 99 area.
Yes. Oh, that is very heavy.
Yeah.
We
for
don't
sure.
speak Punjabi, but we speak Hindi.
Hindi,
So,
theek hai, same hai.
Yeah, so we
Yeah.
just
Theek hai.
manage with Hindi.
manage.
Yeah,
Where are you guys? Where's your back?
Gujarat.
Oh, Gujarati
Gujarati.
Kim
Both
show.
of us
Yeah.
are
Ahmedabad,
from
yeah.
Ahmedabad.
Ahmedabad, Gujarati.
Yeah.
The Dandiya, right?
Yeah.
Yeah.
I know.
All the
I have a
way.
lot of Gujarati
We
friends
go every year.
to that. Yeah.
Yeah. Do you have a lot of Punjabi patients there in your other
Yeah.
practice?
Yeah.
Nice. It does make a big difference. Like we have a lot of patients who really prefer because then they can like tell
Yeah.
you more, explain themselves.
It's
better.
same thing like
Yeah.
Gores don't like us. And whenever I work with beer, they're like, we don't want you, you know?
Yeah.
I mean, Gores don't like, just everybody likes their own. It's just the way it is, you
That's
know?
just, yeah.
Indian tikka.
Yeah.
Gee.
Mm.
We kind of have a good balance. We have a lot of Mediterranean from different Turkey and all these people coming to us, Persians, and then we have a lot of black families coming, we have a lot of Punjabi families coming. But the most out of all of them is Mexicans and whites.
Yeah.
Because Bakersfield is mostly Mexicans and whites.
Mostly Mexican and whites.
So
More
that's
Mexican.
still,
A lot
so
of
it's a good
Mexican.
pool. We get everybody.
But the white people here are very low income, so they're kind of thuggish.
Yes, yeah,
They're kind of
yeah.
they're not so they're almost
They're
Mexican.
country, right?
Yeah. They're not like I-5 Orange
Yeah,
County.
No. They're not the
Those guys. They're like chill white people. Yeah.
But it sounds good to say Bakersfield has a lot of white people.
Yeah. Yeah.
But so, for example, if let's say you do come for like a work interview or something, we can show you. Are you comfortable doing like a teenager, 14, 15-year-old kid?
Yeah.
Like MODs, like MOL, MODs, just 12, 13, 14,
Yeah.
and then 18, 19, whatever, you know? So that's kind of the dentist. If you're not experienced with kids so much for years, then that's probably half of your day, most of your day, you know? Because then we can start training you with the babies, especially if it's a good parent, she's cooperative, you can go in and the patient is controlled, they're not crying, screaming, we've done treatment, he's really good, then you can start trying. Or if the patient is on the baby board, then you don't have to worry. That's the safest way to do treatment because we have our assistant holding head, we have the papoose board, patient can't move. Still, it's hard because you have to get in there and get the work done.
And you
It's
have to do it
sometimes
safely.
you have to do it fast and safe. You have to get him out of the board. You know, you don't want to take too long trying on crowns and choking hazard. All that stuff is still very, very high risk liability wise. But slowly you get to train in that side because that will take longer to learn. But are you okay with doing like MODs all day long? Because big adult teeth fillings is okay. Yeah. Because we don't do crowns. We don't do root canals. We only do open and med or some root canals
In adult
teeth. So it's mostly baby teeth
And
fillings.
we do extraction on adult teeth if they're in pain and they're like non-restorable, then we just do it in the
And then you place a space maintainer too, right?
Yeah.
And ortho extractions.
So
and
everything pediatric and then limited in adult.
Yeah.
And
Do you
we
do
don't
that right
hygiene.
now? You do a lot of
because-
fillings and stuff right now?
Yeah.
I
Nice.
don't know how hygiene works for medical, but we don't do like the ultra like scaling because usually like our kids are like teenagers, so they don't need like that. So we just do like both.
Yeah, so when we're doing
We do a
exams,
hand scale and
Yeah, usually you don't need because we do have a staff of RDAs who take care of the prophy, so your responsibility is just like doing the exam.
there's some patients that have calculus here, then we just plug in our ultrasonic really fast. Instead of hand scaling, it's really quick with the water and it's got in 2 minutes and
It's
you're done.
faster, saves
We just
you
do that.
time.
Teenagers need it sometimes, so we do it. It takes 2-3 extra minutes, but yeah, it's nice. Parents want it. Sometimes they'll ask for it, like, oh, can you please clean this up? He has some stuff there. So we do it, yeah. But we don't do full-on hygiene cleanings, nothing like that. Yeah.
Yeah, we don't. That's one good thing with pediatric offices. You don't need hygienists.
Right,
They're anyway like expensive according to
Too
me.
expensive.
Yeah.
$325 a day, $350 a day.
Crazy.
Yeah.
So like all our friends who do general dentistry, like adults, that's their main complaint. Like it's hard to like afford them.
Yeah.
Yeah. But that's one less thing for us to worry about. Any other questions for doctors?
So, what road you say? What was it called?
Truxton.
And what's your clinic
My
called?
kids.
My
Happy
kids.
Teeth.
Happy Teeth.
Yeah.
Yeah. Okay. Well, no, we're just looking that way for an apartment or a house or something.
Nice, yeah.
I just want to know since she's gonna work here, we want it very close, walking.
If you're gonna move to Bakersfield, I would suggest looking at more of the northwest side. If you go to our office and you pass by it, don't go east. Stay on the west
this
side.
Yeah.
Don't go on the east side
Right,
at all.
right.
I would never pass the freeway to live there. On
Yeah,
that
yeah,
side.
yeah. Okay.
This side is very nice. Like this complex and everything. All the houses here, big houses.
Yeah, it's
very
nice place.
houses. 7 Oaks and everything is very, very nice and expensive too. But northwest is expanding. Even southwest is
A lot of
expanding.
new construction.
So there's a lot of new
This way.
houses.
Why didn't you guys decide just to buy the building rather than?
It's not for sale.
It's
yeah.
not
Oh.
for sale.
Yeah, it's brand new. It's like he just bought the land and made his own office. He's
Okay.
an orthodontist.
Oh, okay.
So he has his own ortho office, and then he has another land piece right here that he's building another office to lease
For you
out,
guys.
to lease out to somebody else, which we took.
And then he wants you to give you all the ortho patients, right?
No, that's one thing we said that like
You can't force this.
I can't force a patient, and I'm gonna continue telling them go whoever
to
you want.
refer
Refer,
him.
yeah.
But it's amazing marketing for him.
Yeah, amazing marketing.
We
yeah.
see a lot of hate. So I use that as negotiation with him.
Yeah,
I said,
like
"Look,
they're gonna come right here.
If I take your whole building,
Yeah.
you don't have to get 3 tenants. He was going to get 3 tenants.
Right.
We're going to split up the office in 3 and build out one of the, and then ask for people to rent it. So I'm like, you don't have to do any of that. I'll take the whole building, right? You don't have to deal with 3 tenants. I'll sign a long-term lease, and it's pediatric. So these patients that start at 2-3 years old with us, then they get 7 years of age, I tell them to go to see an orthodontist.
And he's right there.
Right? So
And it's free consultation. They get
Yeah.
$150 just to take a panel.
Oh yeah.
Whether if they get Medi-Cal or approved, not approved, nothing, $150 just for one panel.
Yeah.
Every orthodontist.
Every
gets that?
orthodontist.
Yeah.
Medi-Cal. If they come in with that medical card, they don't even need any referral, nothing. It's $150. Just panel,
Yeah.
boom.
Nice.
Just to look.
What about PPOs? Is there a consultation fee?
Yeah, PPOs too.
Yeah.
Yeah. But the big money is that Medi-Cal ortho. Boards and your guys' job, or what my job was to do, is see Medi-Cal doesn't pay if there's primary teeth in there. So my job was extract all those primary teeth, okay, and space maintainers wherever they go, and you can do the like class 3 or class 2 or deep bite, labial lingual spread, crowding, that's then get it ready for the orthodontist, so that way the case passes ortho for Medi-Cal, because they have 27 points. They got to send all that to Medi-Cal and they get approved or not. But once you're approved, you're married to the patient for 3-4 years, and it's $7,000. So ortho's good,
It's good, yeah.
That's cool.
Yeah.
Yeah, we have a lot of patients who ask, is Medi-Cal gonna cover? And I always tell them, I don't know. It depends on like your
Unless
point
you're
system.
the 27 point
Yeah.
system. Yeah.
Yeah.
For us, it was really good in school. I did a couple of ortho cases, and it was straight like 800 per arch, and that's it. That's it.
800.
Yeah.
That's it for Medi-Cal.
Because I was in school.
Yeah.
Yeah. Schools don't get paid.
So
Yeah.
like a lot of patients came to school because it was
It's
so
cheap.
much more cheaper.
Yeah.
But then we were not as experienced as the graduated.
Right.
So,
Yeah. To see, my job was to see, is the patient gonna be ready for ortho? Medi-Cal is gonna approve the ortho case, yes or no?
Yeah.
That's what I was really good at, to figure out. Okay, this don't even mess with it.
Yeah.
Or yes, look, this is gonna work.
That's a big one. 'Cause
Yeah.
a lot
It's
of
a little
parents-
gap.
Very
Yeah.
cool.
Yeah.
Very
So right now, where are you working exactly?
And Tulare Western Dental.
Western
cool.
Dental.
Western
Okay.
Dental.
Yeah, so you're doing a lot of general dentistry, right?
Yeah.
Every day. Okay. Yeah.
Very nice.
Yeah. That's where Rishi, my friend from Moldova, is working there. Western Dental. A lot of good experience.
Yeah.
Yeah. Do you deal with trauma cases sometimes?
Like splinting. Or
No, it's with the oral surgery.
Or
Okay.
surgery?
Um,
White fillings in the front?
Yeah.
You do?
White
A
fillings.
teenager breaks his teeth.
Yeah.
We get that all the time.
Yeah.
yeah.
So I don't touch any adult teeth. I try not to. I stay away from it. So I give it to associates. Like every adult patient that comes in, any fillings and stuff, please schedule with the other doctors. Yeah, because I like to stay focused more on the exam side, and then complicated baby patients as young as possible. We try to focus on that. Yeah.
And then did you work on any GA cases while you were there? I know
No.
Children's Choice have
I just-
anesthesiologist Wednesday or something.
Something,
Yeah, they have. So I was just observing.
Okay. You were doing
Yeah.
like conscious.
Yeah.
I mean, we anyway don't do that. So.
Yeah, we do nitrous oxide. It helps a lot. Yeah.
Nitrous oxide is
Yeah.
good for you. Like,
Yeah.
have you used that?
Yeah.
And if the kid is aggressive, not letting us do work, we're not able to control them, then we send them to sleep dentistry. Yeah. But most
That's
of
a
the
very
time,
small portion. Yeah, we believe that a lot of it is behavior management. So if you can manage the behavior of the patient and the parent, like you don't
Take
need to
you
like
have to be
put
good
the-
at that.
Yeah.
Your dentistry comes
So you
second.
need to teach
Yes.
that.
Yeah.
Teach.
Yes,
And
yes,
it's
yeah.
just words, so we can figure it out
Yeah.
real quick.
Yeah.
Yeah,
Yeah.
yeah.
It's about explaining all the scenarios, just being as transparent as possible. If it's your kid, you're gonna ask these questions.
Right.
You know, so if you go in with that mentality, it's like, of course she's gonna ask questions. It's a 2-year-old that you're gonna drill into his mouth with a lidocaine. Of course, I have questions for you.
Like being a psychologist every time, huh?
Exactly.
And
Yeah.
then a salesman.
Yeah.
That's the first part.
That's
yeah.
Psychology, then
Favorite.
salesman.
The good thing is that we don't have to talk about money so much.
Yeah, because
in
Medi-Cal
Medi-Cal,
pals.
like,
Yeah, but
so
We don't sell anything. In
Yeah,
our
you don't
office.
have to sell.
We don't
yeah.
sell anything.
Yeah,
in
so
our office. So
we're-
you're not trying to sell
So that's why
anything.
it's a relief because we only talk about the science and the dentistry and making sure like your questions and our communication is strong. then everything else is like not
Yeah.
a big problem.
That's what my favorite part is at the office. Is the challenging psychologist part is behavior management. It's like making sure the parent is happy, understands what we're doing. The kid, I have to talk to the kid, make sure he lets me brush his teeth. I say brush his teeth every time, no matter what we're doing, crown, root canal, whatever. Can I brush your teeth today? You know, and that's the first question that gets them
You know how
active.
they say niyat? That's what the parents are looking. If your niyat is
It's off.
clean,
Yeah.
Yeah.
then
Okay.
they'll trust you, and even if there is little plus and minus, because we cannot guarantee the results of everything, right? You can do the best root canal, most ideal way, and it can still get infected, and
Right.
then you have to extract. But if your niyat is clean and the parents sense that, and the kid sense that, then it's better.
Okay.
Yeah,
Vibes, yeah.
yeah, it's a big thing. Yeah.
Or else they go different places, and we get a lot of patients coming saying, "This is a second opinion. I just went to this office, and they'll straight up everything, you know." And we're like, "Yeah, that's fine."
So basically, you guys are getting the Medi-Cal patients, but giving them.
PPO service.
Yes, that's what it is.
Why
PPO.
not? It's a kid. It's a kid.
Yeah.
It's not.
And it's just one more cubicle. So what's the?
We worked at a corporate office for 4 years, right?
Oh, you did,
and
yeah.
We only saw medical patients,
Uh-huh.
and we love the population. We feel like they need the help. We feel like they need to be served better, right? So why does it make a difference if you have this insurance or this insurance? We don't care.
Right.
I don't even know what my patients have insurance. When I talk to them to exam, I treat everybody equally.
I get it.
I don't even
Who
know.
did you guys? Who did you work for?
Smile line.
Oh yeah, that big one.
They
Yeah.
have, yeah.
Yeah.
They at that time they didn't open in Fresno, so he was more in this area. Now he has Fresno, Visalia, Bakersfield. He has 3, 4. I think one this way, right? Yeah.
Multiple, yeah. They might be hiring in Fresno location.
To be
too.
honest, they're
opened.
good too. The only thing is that they're getting bigger and bigger, so it's hard for the main doctor to like control the quality.
Yeah.
That's the only thing.
Quality, yeah,
Yeah,
and the
very
and that's
interpersonal.
the main thing, and which is okay. Like he's a very good businessman, but for us, we're also clinicians along with
Businessman, yeah.
Yeah.
Clinician and businessman both.
Yeah. You can look into that too. They just opened an office in Fresno.
It's on the ad, yeah. They it's
Yeah.
on
They're
that
always
book.
looking. Yeah.
Everybody looks now on everything.
Yeah. You
It's
should
the,
check
it's
that
the
out,
world's
yeah.
changed now.
We
Yeah,
had a
it's
good
all on.
experience.
Yeah, we
It's
did.
not their name might not be a good name in town, but we never say anything bad about them. We had a good experience. We learned a lot from
He
them.
never told us how to treatment plan.
Yeah.
That's the main thing, because they, you know how sometimes they have these business people in the DSOs,
And they don't even know. They don't even know anything about
And
dentistry.
then
Yeah.
they push you that no doctor, do this filling, and then in Smiland that never happened. I
Okay.
could tell them that no, I'm not gonna drill. We can watch. It's a stain.
They never
Like,
told
don't
us
do
that.
like
How long did you work at Smiland?
3, 4 years.
4 years.
Okay, and you
Both
four.
of us, yeah.
Very good relationship.
I
It's
drove
just
to
that we
Delano.
outgrew that office. Now we want it to
Of course.
grow
Right,
for
right.
us. But
Right.
that's the
The pay was low compared to what we pay our
$850?
associates. $700 per day.
Yeah, that's too
But
low.
they don't pay you for your exams and like pro fees and X-rays and things like that. So when you do an exam, you get on your production at least $100. But when we do exam there, they put $15,
Yeah.
and and then we get paid 28% of that $15 per exam. So we made no money, but a lot of experience.
That's what you guys went for, the experience.
Yeah.
yeah, and
yeah.
we were new grads.
And we were new grads.
New grads, yeah,
We
yeah,
didn't
yeah.
know.
Yeah, yeah, right.
And then I got my job after, and that doctor paid me everything I did,
Yeah.
including X-rays, IOPs, sealants. The assistants does, but it all counts in my production.
Good.
So that helps me make more money,
Right.
and I feel like I want to work here, and I want to make sure the patient's taken care of, because everything the patient gets, any extra punctures, any sealants, anything, is my production.
Right.
So the owner dentist is not the only one making money. I'm making as much money as I can. So.
How was your experience in Moldova? How is it like?
Good.
Yeah. 2 years or
2 years.
2 years? It was nice. Like, is it the same like in India and here, or different?
A little bit different.
Like, little bit different. Language is what again?
Romanian.
Romanian. Okay.
They've closed now, right?
Yeah.
I think this
Yeah, they
year.
lost it. She was like she got
Yeah,
it at the
I know.
right
It was a
time,
war.
Very lucky.
Yeah, it was war or something.
and they lost her accreditation.
Ukraine and
Oh.
Russia.
Yeah, they can't. They just.
No
they-
more.
they
She
don't
got.
have
She was
the
only six generation. She was in one of them, so it
Nice.
worked out.
Lucky.
Yeah, a lot of
Good.
people moved to Italy now, like from Moldova.
Yeah.
Yeah. Because of the war. Yeah.
Yeah, no, good you went and did it. It's important to get your license. And then come to America, you could get experience.
Yes.
It's hard to get admission.
So when you went to pediatric school, the main thing you learned was anesthesia pathology.
Oral conscious sedation,
Uh-huh.
trauma. I was
Trauma.
in the emergency department at hospital.
With the kids trauma.
Yeah,
Dental.
they or abscesses and all that. So when they get hospitalized, then they have to call you. And then we also did like hospital medically compromised kids with like cardiologists and other specialists.
Oh, really, okay.
And then what else? Trauma, that, and then ortho,
A little bit of the phase 1.
phase one. What else? Yeah. Otherwise, it's bread and butter.
A lot of experience, a lot of good experience. Yeah. Like we
Yeah.
get patients 7-month-old who just
That's
came
also
to us.
one thing that like if you're gonna stick with pedo, like at least for us,
Yeah.
at least one of you should do the specialization. What if 15 years down the line they specify that we only want specialist in something? Then
Right,
you
yeah.
shouldn't be like your hands tied because now we can't go back to adult. Like we're already
Yeah.
too deep in pediatrics, so then we want to like make it
That's one
sealable.
major benefit that she's a pediatric dentist, so we can now officially say we're a pediatric dental office.
And take the PPOs.
Before you
Yeah.
can't. If I own the
Yeah.
office alone, I can't say I'm a pediatric
No,
office.
No,
even
you
as a
can't.
I have to say
marketing.
children's dentistry, but I can't say pediatric.
No, you
like
can't.
Smileline doesn't say pediatric dentistry.
No, it doesn't.
Yeah.
And you don't write not special, practice limited
Pediatric
too.
dentist.
Yeah. So she is a big benefit in that sense of going to school. Not only the experience, but also the name counts a lot.
Yeah, we are board. Yeah, they count. They
parents
ask.
read our website and come, and they know us already.
And
you
I
know, so-
feel like in the future, parents will only be more and more picky
Picky.
about these
Yeah.
Yes, they read up more.
Yeah.
But the pay is the same, Medi-Cal and
Pay
PPO.
is the same. Yeah, not the money. It's just like your patient pool increases.
Right.
And just future security.
Do you have enough patients to run one of your clinics 24 hours a day?
No, I don't think they would come 24 hours a day.
At night they won't come. Huh?
But I'm sure full day Saturday, Sunday I could get it packed.
Packed.
Yeah.
Saturday, Sunday.
and Sunday.
Let's say you had the dentist and the assistants. You
Uh-huh.
couldn't run a night clinic?
I don't think so.
I mean,
'Cause
we
kids have
could,
school.
we wouldn't want to, is the thing.
No, but also kids have school.
Yeah,
Mm.
practically.
So
Yeah, practically, yeah, they're
So we
sleeping.
get busy in the afternoon when the school's out.
That's when
Morning
you
is
get
a little bit slower, typically. Yeah. So summer, it's busy because they're out.
So what time does it get busy? 12 to
No, I would say like 2 to 5.
2 to 5.
2 to
It's
5 is the
really-
busiest.
That's right when they come from school. Let's go to the dentist.
Yes.
Exactly.
Yeah.
And a lot of it's strict in school now, so they can't like take off just like that. So
It's
in the
not that
morning
easy.
is our babies who don't go to school, like
Yeah.
under 5.
Oh,
And
you're
afternoon
smart.
are the
That's how you
older.
schedule it. Yeah.
Yeah.
And it also works out because the moms tell you, and it's the same thing with all the moms that
Yeah.
if it's an older kid, they're like, can you do something after 2? And if it's a younger baby, like, can you do it in the morning? Then I have to go to work. So
Yeah.
it's
Right,
very-
right.
They adjusted for us. Like we never
Yeah.
made it like that.
Right.
Yeah, not for pedo. I think not night clinic for pedo,
No.
but for adult dentistry, it would
Oh,
work.
so
But you
yeah.
said Saturday, Sunday, you could pack it out.
Yes, yeah,
Yeah.
for sure. That's
And you
what
have
we
enough
started.
assistants to cover that too? Or not yet, but you could, huh?
Yeah.
Yeah.
If there's a doctor that's coming Saturday, Sundays,
Yeah.
yeah, for sure. Yeah, we would love that because that's opening up more days. We're able to see more treatments. Right now, we open Saturdays because we kind of have to because there's so many patients in pain that we can't push them in July, August. We have to squeeze them in, so we open some Saturdays. I ask the assistants who wants to work, and
You
they
pay them
all give them
overtime?
overtime, and then the doctor.
Wouldn't it be
comes.
cool if like you didn't have to pay those 40 hours overtime and you just had another army come in?
Yeah.
That'd
Yeah.
be cool,
I've thought
huh?
about
Yeah.
scaling a lot.
I think that's gonna happen one day. There's gonna be like an
Yeah.
app or like Facebook Marketplace. Hey, assistant want to work on Friday, Saturday, Sunday. Then they don't have to pay overtime.
Yeah.
Yeah.
I think
I've
it's
thought
coming.
about it. I like
Yeah.
business a lot, so I've thought about all the staff members I have now,
Mhm.
make them into 40 hours in 4 days.
That's it.
10-hour days,
Mhm.
and then Friday, Saturday, Sunday, another staff team comes
Right.
10 hours a day.
Right.
And, you
And
can
then
make
those
it
40s that get that 40, I know they're greedy. They're gonna not even take a day off. They're gonna work somewhere else
Yes.
40, and that's
Yeah.
not your problem. You don't
Yeah.
have to follow those overtime rules.
Yeah, exactly.
Yeah.
Yeah. So then you can have 2 teams working 4 days and 3
3
days,
days.
and open 7 days a week.
Yeah.
And you're working 10 hours a day,
Yeah.
and you're full. So
And no
yes,
overtime pay.
No overtime pay. Yeah, I've thought about it.
Yeah.
Right.
Yeah.
I've even thought about lunchtime because I go to a office where I'm a patient,
Uh-huh.
and this is how they run their office. It's here. They open at like 7:30,
Mhm.
and half the team comes at 7:30, half the team comes at 8:30,
Okay.
and so so they're open 1 extra hour at
Mhm.
the end of the
Oh.
day, and at lunchtime one team is always working.
There
So
you
you're
go.
not close for that 1
1
extra
hour.
hour.
Pay for extra.
It's
Yeah.
like, hey, come after lunch. No, we're
Yeah.
closed. They lock the door. No.
No.
That other team's working.
Right now we're like closed for 1.5 hours for lunch. Like sometimes we don't schedule the 12 o'clock appointment and the lunch is from 12:30 to 1:30, and like 1 or 2 exams don't show up for like 2 hours. It's just nobody there.
Yeah.
It's like we want to improve and even be more efficient, but slowly when we have more doctors.
What happens if the minimum 1,000 is a minimum if someone comes or doesn't come, right?
Yeah. Because we don't. It's not your responsibility to
You
bring
the
patients
patients,
into my office.
Yeah.
Yeah. I'll make sure they're there. Yeah. Yeah, and that's one of the benefits.
All
of
What's the
your days.
let's say she wants to, like, what's the minimum production you're looking? What do you like?
For us to be okay
Uh-huh.
and not take money out of my pocket to pay you is at least $4,000 a day.
Right.
Yeah.
You
which
showed me
is
that
easy.
paper.
Yeah.
Easy.
That's why the minimum pay is 1,000. If you make 4,000, 25% of it is 1,000. So and then that's how we were taught. That's how I get paid at my job where I work
Right.
associate. So everything's the same. Very very fair. But I'm telling you, if you work hard and you're able to get patients done, fillings, MODOs, baby teeth, anything, and you're doing exams in between running inside, one of our associate continuously produces about $6,000 to $7,000, which is $1,500 to $1,750 per day. Every 2 weeks he's earning
6,000.
regularly.
6,000 production, 1,500 a day.
Yeah, and 7,000, 1,750.
8,000 is 2 grand.
This is pretty typical.
That's 6 and 7, huh?
Yeah. If you're working and you're willing to work, you're there ready
Fast
to
and
go every
go.
treatment room. Yeah, you can make 6 to 7
How
easy.
much is it for you right now in Western Dental? Like,
It's plus production almost 1,000 plus production.
no, like not your pay, like how much you
800.
produce.
Like
How much
the
you produce per
production
day? Yeah, production.
is minimum is 2,500.
Minimum is 2,500. How much do you hit every day? Are you able to hit 25?
26, yeah.
Yeah, nice. And that's
Yeah, I know
mostly
it's hard in
Hard
adults.
done,
It's
yeah.
different.
It's different, not that much money in adults.
yeah. Crowns and root canals and stuff. Is it more expensive? It helps your production or more
Because in
fillings?
the Western Dental, sometimes they tell me to refer the patient to the endodontist
Yeah.
for the molar root canals.
Okay. So mostly your production is being by the fillings.
There's fillings, crowns,
Okay.
the partial dentures.
Yeah. Ours would be a little bit faster than that because one, you're not seeing an adult patient for so long. You're seeing kids. Some fillings are really small, and so it's really quick and easy. Sometimes you don't have to numb. It's like 3 occlusal, 3 OL, right?
It's PPR.
It's a brand new. Yeah, it's quick, and plus we use nitrous. So if it's PPO, it's $114 for nitrous, plus the 1 occlusal that you did, right?
Yeah.
And it took you 10 minutes.
10
to do
minutes to do it.
So it's a lot of money. Or you did 8 fillings with nitrous, and that's a lot of money. So the more teeth you do, the better it is. Plus nitrous helps. So yeah,
Does Medi-Cal pay for nitrous?
yeah. Medi-Cal pays like 40 something, but still
Better than
helps.
nothing.
If you're doing O&P extraction and you're adding nitrous to it, then it's worth it for you, right? Because you
Right.
got OP, EXT plus nitrous.
Mhm.
It's worth it. It's worth it. Yeah.
And you do the space maintainer chair side, you make it real
Yeah.
quick there?
Yeah.
Both. We do both. Depends on the case. But
Not
if
bilateral,
You,
just
yeah.
unilateral.
Unilateral right there. Bilateral
Yeah.
you send to the lab?
Yeah, you
Yeah.
cannot do a
Right.
bilateral on
It's
chair
productive
side.
to do chair side unilateral.
So do you extract the primary tooth? Or when do you take the impression first? If it's a bilateral extraction, you can take the impression first,
Yeah.
Do
extract,
it first
same
or
day
after-
extract.
first or after.
Usually we prefer first because once it's bloody, you
Yeah.
don't want to take an
Impression,
impression.
yeah.
So usually it's before.
Okay.
But sometimes the kid is like
Yeah.
not the best, so
Or they're
we're
in
like,
pain, you just gotta
like
pull 'em.
first do the thing and then, and usually parents understand, and then chair side is in one.
Do you take a picture of every treatment you did? Yeah.
No, like
Every tooth?
yeah. Like
Before
or
doing it?
after. Yeah.
Yeah.
You have to for claims.
Medi-Cal, it's very hard.
Yeah.
They-
Before and then after?
Not after.
Just before.
Yeah, but with associate dentists, this is how we were gone through too. Like for work interviews and things like that. Once you do a filling, we take a picture after too.
Right, just
everything you do.
It's
yeah.
actually good as a
Very
new practitioner because then you learn it's more for you or like yourself because then you learn that like maybe I can change this like that because that's how we learn. Like in the first few weeks we're like maybe I can do this and it will be easier for me. So
Yeah.
it was a good tool for me.
That's part of the training. But that's how I learned the most. Is when I did my filling and then I take a picture right after. I'm like, oh, I should have been careful here. Or the IOPs they take, I'm like, oh, it looked good in the mouth, but now it looks like this. I need to be more careful. And I got better and better and better. And then they stopped taking my pictures and so it's very, very beneficial. You learn from your own mistakes.
All right.
Yeah. Thank you for meeting
So
us. We'll stay in touch.
Yeah, stay in touch. Then you said August was.
Yes,
August was
tentatively.
tentative when we can start doing interview because if we start the second office.